Hi everyone, Dr. Mara Weinstein here, board certified dermatologist. Welcome to my channel. Today we're going to talk about hair loss. Hair loss is one of those things that pretty much affects everybody. And when it sets in, it can cause significant stress, affect your daily functioning, your confidence, and self-esteem. So it's important to really understand why it's occurring and what you can do about it. In the broad spectrum of hair loss, there are two major categories. There's non-scarring hair loss, or alopecia is another term, and there's scarring hair loss, or scarring alopecia. Let's start with scarring alopecia. So this can occur when there is an inflammatory condition on the scalp, or it can be due to autoimmune issues, where you will notice bald patches on the scalp where no hair is growing. The hair actually drops out of the follicle, and that follicle closes and turns into a scar. At the first signs of this occurring, you really want to seek help from a board-certified dermatologist. Our goal is to prevent further development of scarring alopecia so you don't have permanent bald patches on the scalp. Ways to tell if you have scarring alopecia is if there are smooth, shiny bald patches developing on the scalp. In some patients, they can be directly in the center of the scalp. That's more common in our African American and darker skin patients. And in some individuals, it can occur on the frontal hairline. So you'll notice that your frontal hairline starts receding back and back and back, little by little, and that's typically seen in women. That's a condition called frontal fibrosing alopecia. There's another condition called lichen planopilaris where you can get shiny, scattered bald patches all over the scalp. And you'll notice if you look at each follicle, there's a rim of redness or erythema and a little bit of scale. That's classic to a condition called lichen planopilaris. If you have or suspect you have any of those three conditions that I just listed, frontal fibrosing alopecia, central pattern baldness, which is also known as CCCA, or lichen planopilaris, then seeing a board-certified dermatologist and getting a proper workup, diagnosis, perhaps a biopsy, is the first best step to prevent further development of permanent scarring hair loss. The second and probably more common type of alopecia that we see is non-scarring alopecia, where there's diffuse shedding and thinning of the hair, but the follicles are actually not scarring down, and so hair can be regrown in the areas that you've lost. The most common culprit of this is a condition called telogen effluvium. This is when you have an increased shed. So you would notice that in the shower for a few weeks at a time or even months, the hair keeps shedding and shedding and shedding. This is also a time where it's really important to seek help from a dermatologist. We'll go over some simple things you can do at home in the meantime while you're waiting for your appointment. And so what can you do about this shedding? We all lose about 150 hairs a day in the shower or with brushing. That's a normal amount of shedding. If you feel like you're losing more than that, then you might be experiencing a condition called telogen effluvium. Telogen effluvium can be caused by many different factors, including stress, a traumatic life event, maybe there was a death in the family, maybe you had a surgery or some type of illness that you're recovering from, nutritional deficiencies, thyroid hormone imbalances, and also conditions that actually directly affect the scalp. So if your scalp is not healthy, then it's going to be hard to grow and maintain hair. Here are some simple things that you can do if you start noticing an increased shed. Number one, take vitamin D supplements. Typically, a lot of people, unbeknownst to them, are deficient in vitamin D. Vitamin D has strong anti-inflammatory properties and can help reduce any inflammation in the body and also on the scalp that could be contributing to your hair loss. Number two, start a supplement hair loss vitamin. There are many out there in the market. My favorite is either Nutrafol or Viviscal, and you can check them out in the links below. But these vitamins have really been clinically studied to help nourish the follicle and replenish the follicle of the essential nutrients that it needs to grow hair. The next thing that you can do is invest in a anti-dandruff shampoo. So even if you don't have dandruff on the scalp or notice it coming down on your jacket or your t-shirt, we all have yeast on our scalp, and in some patients, in some climates, and during some seasons, it can actually overgrow and affect the health of our hair. And so using a simple anti-dandruff shampoo containing zinc pyrithione, that's the key ingredient, can help improve the overall scalp health. The next thing you can do is pick up some over-the-counter minoxidil. This is a hair growth topical agent that can help regrow hair. The trade name is Rogaine. It's available at your local drugstore. And we recommend using 5% foam and applying it once daily at night. This will help to get all your hairs back in the anagen phase or the growth phase, and they'll stay in that phase and continue to grow until you can help regrow your hair once you've experienced shedding. The last thing you can do is invest in a low-level light cap. There, again, are a number of low-level hair light caps on the market, but low-level laser therapy on the scalp has been shown to, again, reduce inflammation and help to nourish and regrow hair. These are all simple techniques and you can start today if you're starting to notice hair loss. To learn more about hair and hair loss and what you can do about it, and all things related to skin and aesthetics to get your skin glowing and leaving you feeling like the best version of yourself, make sure you like and subscribe below. Thanks for watching.